One of the things that I get asked a lot about as a lactation consultant is whether or not my client's symptoms are thrush. So thrush is another name for Candida albicans, which is a yeast infection. So Candida albicans is actually a normal part of the human microbiome in small amounts, but it's opportunistic, so that means that if it has the opportunity, it takes over. So one of the things that can make somebody susceptible to this kind of infection is if they've been on antibiotics recently. So everyone who has a cesarean section gets an IV of antibiotics during their delivery or prior to the delivery, and if it was an emergency cesarean, they're on antibiotics after the birth. So a lot of people, almost 30% of moms who have recently delivered, are at risk for having thrush. One of the major signs and symptoms of it is when somebody says that they have the sensation of broken glass inside of the breast, and interestingly, it is usually after the feed. So after they've finished breastfeeding that time, they will have that feeling come on about 10 or 15 minutes later. And sometimes there can also be topical, like skin related symptoms. Sometimes babies will have white patches on the inside of the mouth, but what I find in my work is that that's pretty rare. Usually the moms are symptomatic and the babies are not symptomatic. And I don't actually have any understanding of why that is. Some of the common treatments for thrush include nystatin, or also oral antifungals for the mom. A common one would be fluconazole, also called diflucan. This one is pretty effective, and moms will see results in as little as 24 or 48 hours, but they should continue to take the entire prescription.